So here we're going to work the hamstring, and we're going to work the hamstring in a rotational manner. Obviously the hamstring is somewhat a linear muscle. However, there are some oblique fibers to this structure due to its ability to act on the knee. So when we're releasing the hamstring, of course we need to work directly up and down, but we need to also help this muscle relax by adding in a rotational component. And the easiest way of doing that is I like to start with a broad palm, and I push the tendons, semimembranosus, tendinosus, and a little bit of gracilis here. I push the tendons away, and I either maintain this position, so I don't push this way. So first of all, I just maintain my hand here, and I push these tendons away. So here we're working across the line of the muscles. Then once I've done a handful of these, just to soften the tissue, I'll maintain contact and then I'll pull. You have to be careful here if anyone's got any sort of medial knee issue. This may create a bit of torque on the knee. So I maintain my grip and I pull. 1, 2. Maintain my grip. 1, 2. Then what I like to do is push and pull at the same time, because we're really trying to create a shearing force here. I get nice and low, bending my knees, protecting my back. I push away with my left hand and I pull at the same time. So it's pushing, pulling. 1, 2, 3. And I work all the way up the hamstring towards the ischial tuberosity. And if you find a spot where it can aggravate the knee, then you might go back to the first one, just here. Okay? Mm-hmm. I work all the way up. Right now I'm using a palm. I can't come in with a fist. I can even come in with knuckles, depending how specific you want to be. So this is working the medial line. The same is true for the biceps, the lateral line, biceps femoris. The bicep attaches to the head of the fibula on this outside. So again, it has a ability to torque and twist the superior tib fib joint, generally in external rotation. So same thing, I plant way down low, and I maintain contact with Kiki's foot, and I just push laterally. Be careful here, it can get a bit burny. There's a pretty superficial nerve back here, the peroneal nerve, so be careful around that joint, that structure. So here I'm just pushing away, and Kiki's foot wants to follow me. So you see here, he wants to go with me, but I just brace. And I just brace. Then what I'll do, I'll hold my hand and I'll move her foot inwards to create that rotational release. And we work all the way up to the ischial tuberosity, sits bone. Then I'll combine, push and pull, here. Push and pull. Push and pull. Right now I'm working at one tempo. Depending on what situation what you're working in. If you're working in a corrective type setting where it's just more relaxation, i.e. not pre-event, it might be a long hold. There's no, you can come in and just hold here 20, 30 seconds. You don't always have to be moving, or moving fast, should I say. If I'm working with a bigger person, someone who's very tight, congested in their hamstrings, I'll take a seat facing their foot, and my elbow is at this angle. So I'll get my anchor point here, and I'll start scooping my wrist as I pull this way. So my force is going down towards this way. That's here. So I'm working across the hamstring. too. Now I'm going to pull across this way. So as I pull, I move Kiki's leg this way, just to create that opposite motion. And with most of these techniques, we work the entire length of the muscle. Okay. This is a great technique to add into your work you already do with your general myofascial work, your deep tissue work. Adding this rotational component can really help someone's hamstring flexibility if they're having any type of knee pain, back pain. Great easy technique. So here I'm going to use the palm of my hand and I just push Kiki's hamstring tendons away whilst maintaining the foot position. So I'm pushing away is the first position. The second position is maintain contact and pull. Then I like to progress to pushing away and pulling about the same speed. And then we'll work our way up the hamstring. Normally it's the insertion points of the tendons that tend to get more approximated. So we do focus most of our attention here at the knee, more so than here. Of course we work the entire length, but we really focus here. Same with the lateral bicep femoris, the actual bicep femoris. This is semimembranosus, semitendinosus. This is the bicep. Same, I push away. I maintain contact and move inwards this time. Then we combine both. Push away and move the leg inside. I can just as easily use a fist here. I can easily as well come in here and use an elbow to saw down as we come here. So depending on the size of you and the size of your client will determine which technique you feel more comfortable with. But the premise is push and hold and pull, and then combine. And work your way all the way up. Here you're trying to create this sliding surfaces in these layers of tissues and in between actual tissue, so membranosus, tendinosus, but we're trying to get some real good fascial release of the whole line of the hamstrings.